All right, I am back. I have a 9-month orthodontics update. Lots of stuff to cover in this video. Let's get started. First thing, people have been asking me, does having braces change the shape of your mouth and your lips? The answer is yes and no. It doesn't really change the shape of my mouth or my jaw, but it definitely has changed the shape of my lips. And this is a really good thing, because if you see here, when I close my mouth, it looks like there's actually like a mouthpiece in there. Now, why is that good? It actually brings my lips out. It makes them look more big and perky. And so I've heard from people who have had braces that when they get them off, they actually get kind of disappointed because now their lips have receded and don't stick out and look so beautiful and voluptuous anymore. Another question I get is kissing. Does having braces get in the way of kissing? Does it create problems? Actually, no. I've never had my braces stuck on somebody when I kiss them. It doesn't really create a problem. So if you're concerned about that, that is not an issue. The next thing is, so I have elastics. Here's a picture of how my bite looked about 2 months ago. And this is how much it changed just in those 2 months by wearing my elastics. So you see on the left side, it's completely closed. On my right side, it's almost closed. And this used to be really, really open. And when I would smile, you could see a big gap there. That's almost completely gone. So I wear my rubber bands 24/7, except when I eat and I brush my teeth. Maybe if I go out socially, I'll take them out for like an hour. People don't care that you have elastics. And if they do, then who cares what other people think about you? The elastics that I have are called Southern Bald Eagle. These are the kind that my orthodontist gave me. They are actually made in Germany. And if you look in the bag here, there's over 100 of them per bag. And in this bag, you just see all of them here. I can put a bunch in my hand. So this is basically what they look like. So they are these like spaghetti looking things here. They are symmetrical circles. The first 2 days that I had these elastics, it was hard putting them in and out. Now it's second nature, super easy to show you. So I'll take out this one. That's it. It's out, it's done. To put it back in, I start at the top, over, and back in. It literally takes 2 seconds. Now I'm super used to it. So I keep this in my pocket, is wax. And even though I don't use the wax anymore, inside of it is 2 things. One, I have my actual elastics in here. So I have spare ones in case I drop it on the floor or I want to change them out. And I also have this like toothpick looking thing. And this is so great because after I eat, I'll go to the bathroom, and if I eat some like, steak or bread that gets stuck in my teeth, I use this and I can actually clean it out, rinse it with water, and I'm good to go. So this is the way that I store my rubber bands. I highly recommend having something like this in your pocket. Another update is when I got my bottom braces on, I lost both of my back brackets, both on the left side and right side, and I can have them right here. So I lost my left bracket on the bottom, and I lost my metal right bracket on the back of my teeth. The first one came off right away, and I think what happened was there was extra glue that was on top of the bracket. I should have told the orthodontist that it was hitting my top tooth, but I didn't. And so the first time that I ate after I got my bottom braces on, this came right off. It just tore right off. And that was my fault for not saying anything. This bottom bracket came off a few weeks later, and again, I think I maybe was eating something hard and it hit it and took it right off. It was not a big deal, as you can see in this picture. Because the bracket was at the back of my mouth, it was not going to impact the time I had braces on my teeth because it was in the back. And the orthodontist said to me, just take a pair of nail clippers, clip it off, and we can fix it the next time you come. I actually tried to clip it. The wire was so strong, it bent the nail clippers, which was not good. And because the wire was not poking my cheek on either side, I decided just to leave it. And I think it was about a month between when it fell off and when I got it replaced. So now I have it replaced here and here. No big deal, super easy to replace. I actually have a video if you want to see how it was replaced. You can just click right up here after this video is done. Another thing with my elastics, they're so comfortable, I forget that they're in. And so I will try to eat something and the food will actually hit the rubber band and bounce back. I'm like, what's going on? And I realized, oh, I actually still have elastics in my teeth and I have to take them out. So it's actually not that big of a deal to have them. And as you see your teeth progressing, it motivates you to keep wearing them, because the more that I wear them, the quicker I will get my braces off. Another thing that I noticed with my bottom braces is sometimes when you get braces and as the arch is being aligned, the individual teeth may actually look more crooked than before you had braces. And you think, wait a second, I have braces, I'm spending all this money, it's a lot of work, it's not always comfortable, and my teeth look worse, what's going on? Because what's happening when you are fixing your arch, the individual teeth need to create space, and that actually can make it look worse. So for my bottom braces, my one tooth that you can see here actually moved backward and looked really, really bad. Although my overall arch was improving. My orthodontist did this in order to create space so that the arch is aligned first, and then you can straighten the individual teeth. And now you can see my teeth have straightened incredibly. When I went back to the orthodontist, he tightened my lower braces, he removed the wire that was there, and just in a week, look at the drastic difference in my teeth from a week ago to now. And seeing that change between the elastics 2 months ago and the tightening in the lower, it's super encouraging to keep up my treatment. Another thing is, it's really nice being an adult and having braces. You're like, well, why is that? It's because I'm actually wearing my elastics. I'm taking them seriously. I'm cleaning my braces properly. And now that I'm doing everything the orthodontist is telling me to do, instead of fighting him or her, is speeding up my treatment, and it's actually becoming an enjoyable process. Is you can actually carry a mini toothbrush and toothpaste inside of your pocket or in your bag to carry with you. And this is one of these travel toothbrushes that opens up. And it's so great if you have this in your pocket, you're concerned about things being stuck in your braces and being embarrassed. You just carry this miniature stuff with you, and at any time, if it's easily in your pocket, go to the bathroom, use it, your teeth are clean, no big deal at all. So I had my upper braces on for about 6 or 7 months before I got my lower braces on. A major difference that I saw was it is definitely harder to floss and clean my lower braces versus my upper. The reason why is my upper teeth are much bigger. And so there's more space to do flossing, to clean them, versus the lower, much smaller teeth. I think they're the same size bracket, and it's just a lot tighter here. And so it's a lot more work to clean it and so on. I also want to show you how to use wax. So here is what the wax looks like. And what you do is you just take a little piece off. And so here I have like this ball of wax. And let's just say that this tooth right here hurts. Let's say it's actually causing problems with my gum. It's rubbing up against it. I take this thing of wax, I come up, and I actually just put the ball of wax over it, and it stays really, really well. So sometimes when I put the wax in, I forget again when I eat, and after I eat, the wax is still there, and it doesn't really come off. And this is nice because if you use it for a day or two, then it allows the gum to heal, become strong again. Usually after a few days, you don't need to use the wax anymore. And it's super easy to take out. Now it's gone, and you can just throw this in the trash can. I also had 2 springs in my teeth. The springs, so there's one left here, created space. Those did hurt at first, and it didn't hurt because it was actually moving my teeth. It actually hurt on my gum. And so when I would sleep at night, when my lips were closed and not moving, the spring would push up against it, cause a little bit of pain. But again, I think about after a week, that went away and was not an issue anymore. To wrap up this video, I actually want to show you my daily cleaning routine. So the first thing that I do not have a water pick. I don't have anything fancy. And my orthodontist actually doesn't recommend a lot of these things because the simple stuff works. You can spend $100 or something on a water pick or all these fancy things, but the stuff I'll show you today costs a few dollars, not very expensive, and it works well. I use Oral-B Glide floss, and I have really tight contacts between my teeth, so I like to use this because it's easier to floss. I pull it up. So I have my dental floss here, and when I clean my teeth, I always start with flossing. And a simple tip, right? So this is kind of hard to get through the different pieces of your braces, but a simple little tip. If you take this, you can wet your finger or in the sink, and I twist the end. And I twist the end. Now it's incredibly narrow. And look how easy it is to actually floss my teeth. So I go here, and it's through, twist it. And let it go. So that's it. I've learned that if you just twist the end like this and you put it through, you get, and after a few days, again, you get really good at this. So I can floss all of my teeth. There's a lot of braces to go through, probably in about 3 minutes. So it doesn't take that long. It's really important to floss every day because it actually keeps your gums healthy. And when you have braces, it's important more than ever to make sure you have really good clean teeth because you can get cavities easier, food gets stuck more. You don't want to have something sitting in your teeth for several days at a time without cleaning it. The next thing that I do is I brush my teeth. This is Williamsburg Dental. This is my dentist. I get these free toothbrushes. Simple toothbrush, pretty good angle. I use this total white toothpaste. It doesn't do that much whitening, so I'm not concerned about whitening my teeth, and then when my braces are taken off, that there's gonna be a darker spot underneath. This is very light whitening, and I simply just put the toothpaste on, like this. I brush my teeth. I try to be gentle when I do it, and typically, when I brush my teeth, I'll take my elastics out. Brush my teeth, you wanna be careful, you don't push too hard. This is a soft bristle toothbrush, and I'll show you how I do it. And as I brush my teeth, I'm actually putting these bristles between the brackets and gently brushing them. Now with my bottom braces, I got them on recently, so I'm gonna be extra careful when I brush them. So obviously the toothbrush is not gonna get everywhere you wanna go. And so I found actually in my local CVS, this container here. It's really nice because they're all sanitized within this container. If you really want, you can carry this with you. On one side, you have a toothpick where you can clean your teeth, and then the other is actually like a toothbrush. And I use this to go between each of the brackets and actually clean my teeth. And as I mentioned earlier, I carry one of these with me in my pocket in order to clean my teeth when I go out. And this ensures that I'm actually reaching all the spaces between the brackets. So we're almost done. The last thing that I do, I mentioned in my previous video, is the bubble gum blowout. My orthodontist sees lots of kids, but he also sees adults, and he recommended this. You don't want to use something too strong because it could actually affect the adhesive on your bracket, make them come loose over time. So this one is going to keep you from having cavities, but also will not impact your orthodontics. And the bubblegum flavor tastes really, really good. So you fill it up to the line right here. So my teeth are all clean now. I will put my elastics back on. And I am good to go. So I promised a viewer that I would also talk about the spikes or the spurs that are glued behind my 4 front teeth. And what they are is, so I have an open bite in my mouth and my tongue will constantly go through this open bite and not allow my teeth to move in the proper position. So these spikes behind my teeth actually prevent my tongue from going in the gap between my teeth. And because it stings a little bit when my tongue touches them, my tongue will go back into my mouth. This is what they look like. That's what they actually look like. They hurt for the first like 2 weeks when I got them. Now again, I don't really notice that I have them. And you can see just in the about 2 months that I've had them, my bite has already completely changed. The spurs will be kept in my teeth for, I guess, the remainder of my treatment. I have to also keep wearing my rubber bands for the remainder of my treatment. If you have comments, more questions, things that you want to talk about, go to the comment section below. Tell me what you thought. I would be happy to answer your questions. I'm not a trained orthodontist. I'm just sharing with you my adult braces journey, and hopefully that you found this useful to you. Please subscribe below as well. There's going to be a lot more videos, and I'm so excited when the braces are off and the whole thing is done to be able to show you from the beginning to the end my braces journey. And if you're thinking about getting braces as an adult, I highly recommend it. Just do it, get it done. It's for a certain period of time. You don't have braces forever, but you can have a beautiful smile for the next 10, 20, 30, 40, 50 years of your life by doing a couple years of work or less. All right, thank you so much. Stay tuned for my next video.